Hello everyone. Today we can discuss the topic for MCQ, that is blood transfusion. First question: what is the main function of blood? Regulation of core body temperature, defense against pathogens, transport of nutrients, all of the above. Answer D, all of the above. Incompatible blood transfusion lead to all except jaundice, increased plasma bilirubin, increased plasma prothrombin, renal failure. Answer C. Third question. Which of the following is least likely complication after massive blood transfusion? Citrate toxicity, hypothermia, hyperkalemia, metabolic acidosis. Answer: metabolic acidosis. Platelets can be stored at 20 to 24 degrees Celsius for 5 days, 20 to 24 degrees Celsius for 8 days, 4 to 8 degrees Celsius for 8 days, 4 to 8 degrees Celsius for 5 days. Answer A. Next question. After the transfusion of 1 unit whole blood, expected to increase in hemoglobin level zero point 0.5 gram percentage, 1 gram percentage, 1.5 gram percentage, 2 gram percentage. Answer B, 1 gram percentage. Sixth question. The transportation of oxygen from lungs to all body parts is carried out by myoglobin, hemoglobin, prothrombin, platelet. Answer B, hemoglobin. Seventh question. The major function of platelet is to carry oxygen, assist phagocytes, prevent bleeding, maintaining oncotic pressure. Here the answer C, prevent bleeding. Fresh frozen plasma contains RBCs, platelets, plasma proteins and clotting factors, none of the above. Answer C. Anti-Rh antibody can be seen after pregnancy, blood transfusion, DIC, both A and B. Answer D, both A and B. Blood transfusion is contraindicated in congestive cardiac failure, acute kidney injury, hemorrhage, hemophilia. Answer A, congestive cardiac failure. Which of the following investigations should be done immediately to best confirm a non-matched blood transfusion? Indirect Coombs test, direct Coombs test, antibody in patient serum? None. Answer B, direct Coombs test. Whole blood transfusion is done within how much time of collection? Immediately, 1 hour, 4 hours, 24 hours. Answer D, 24 hours. Choose the correct among the following. Febrile reactions is due to HLA antigen. Antigen D determines Rh positivity. The cross-matched blood must transfuse within 24 hours. All of the above. Answer D. All of the above. The better indicator for blood transfusion is blood pressure, urine output, hematocrit, pale skin. Answer C. Hematocrit. The maximum life of transfused RBC is 1 hour, 1 day, 15 days, 50 to 60 days. Answer D, 50 to 60 days. Stored plasma is deficient in clotting factor 5 and 8, clotting factor 2 and 5, clotting factor 7 and 9, clotting factor 7 and 2. Answer: clotting factor 5 and 8. Next question. Cryoprecipitate contains factor 9, factor 8, factor 5, factor 2. Answer B, factor 8. During blood transfusion, incompatibility occurs. First thing to be done: Notify physician, administer injection hydrocortisone, stop the transfusion immediately, check vital signs. Answer C. Next question. Blood can be stored in acidified citrate dextrose adenine for how many days? 10 days, 14 days, 21 days, 30 days, 35 days. Answer C, 21 days. Next question. Blood can be stored in citrate phosphate dextrose adenine for how many days? 35 days, 14 days, 28 days, 42 days. Answer A, 35 days. The process donors anticoagulated hot blood is passed through an instrument in which they use centrifugation to separate the blood components is known as dialysis, plasmapheresis, apheresis, none of the above. Answer C, apheresis. The minimum size of intravenous catheter for blood transfusion is 18 to 20 gauge, 20 to 22 gauge, 22 to 24 gauge, 24 to 26 gauge. Answer A. Next question. 1 unit FFP increases the coagulation factors up to 0 to 1%, 1 to 2%, 2 to 3%, 3 to 5%. Answer C. 1 unit of platelet may increase the platelet count by 5,000 to 10,000, 25,000 to 50,000, 50,000 to 1 lakh, none of the above. Answer A. Storage temperature of whole blood is 20 to 24 degrees Celsius, 4 degrees Celsius, minus 30 degrees Celsius, none of the above. Answer B, 4 degrees Celsius. Storage temperature of cryoprecipitate is 20 to 24 degrees Celsius, 4 degrees Celsius, minus 30 degrees Celsius, none of the above. Answer C. Next question. Storage temperature of FFP is 20 to 24 degrees Celsius, 4 degrees Celsius, minus 30 degrees Celsius, minus 40 to minus 50 degrees Celsius. Answer D. 1 unit of packed cells rises hematocrit by 1%, 3%, 5%, 7%. Answer 3%. Shelf life of platelet is within 1 day, within 3 days, within 5 days, within 7 days. Answer A, within 1 day. In blood banks, prbc is stored at -2 to -6 degrees Celsius, 2 to 6 degrees Celsius, 20 to 24 degrees, none of the above. Answer A. As per National Blood Safety Policy testing, every unit of blood is mandatory for detecting the following infections except HIV, syphilis, malaria, hepatitis B. Answer D. In awake patient, first sign of hemolytic reaction is fever, urticaria, chest pain, discomfort at infusion site. Answer D. Most frequent reaction associated with transfusion of cellular blood components: febrile non-hemolytic transfusion reaction, transfusion-related acute lung injury, hemolytic transfusion reaction, post-transfusion purpura. Answer A. Transfusion-related acute lung injury is caused by genetic susceptibility, anti-HLA antibodies, autoimmunity, immunodeficiency. Answer B. Trally. It is usually present within dash hours of transfusion. Few minutes, 1 hour, 6 hours, 12 hours. Answer C. Most common complication following massive blood transfusion is hypothermia, acidosis, hyperkalemia, hypocalcemia. Answer is D. Next question. In massive blood transfusion, the hypocalcemia is due to hemolysis, decreased parathormone, citrate chelating calcium, all of the above. Answer D, all of the above. Not a complication of massive blood transfusion is hypocalcemia, hypokalemia, hypomagnesemia, hypothermia. Answer B, hypokalemia. Next question. In transfusion dependent patient, symptoms and signs of iron overload are common after how many units of transfusion? 25, 50, 100, 200. Answer C, 100. Features of mismatched blood transfusion except oliguria, hypercalcemia, hyperkalemia, hypothermia. Answer B, hypercalcemia. What blood type is known as universal donor? Type A, type B, type AB, type O. Answer D, type O. What blood type is known as universal recipient? Type A, type B, type AB, type O. Answer C, type AB. According to American Association of Blood Banks, what is the recommended HB level for a blood transfusion? 5 to 7 gram per deciliter, 7 to 8, 4 to 7, 9 to 10 gram per deciliter. Answer B. What solution below are compatible with RBCs? Normal saline, dextro solutions, any medications with normal saline, no solutions are compatible with blood. Answer A, normal saline. The issued unit of packed RBC must be transfused within 15 minutes, 30 minutes, 1 hour, 2 hours. Answer B. Before transfusing a blood component, the nurse assesses which priority item: vital signs, skin color, urine output, latest hematocrit level. Answer A. Vital signs. Here, next question. Your patient is having a transfusion reaction. You immediately stop the transfusion. Next, you will notify the physician, disconnect the blood tubings from IV site and replace it with new IV site and keep the vein open with a normal saline. Collect urine sample. Thank you for your patient listening. Have a nice day.